Namaste Jayvents, myself Jayvent Dr.Barkha Khurana. Today in human physiology, we will be talking about the topic puberty in girls and boys. If we talk about puberty, these are the physiological changes from childhood to reproductive maturity. It is associated with growth spurt, appearance of both primary and secondary sexual characteristics in children. It occurs between 8 to 14 years in girls and in between 9 and 14 years in boys. The influencing factors are genetics, 50 to 80% of variation pubertal timing, environmental factors like status, nutritional status, excessive exercise, and psychological factors. If we talk about normal puberty, they are controlled by endocrine system. In newborn, until 3 months of age, childhood, there is suppression of CNS inhibition of hypothalamus and feedback of low estradiol due to high sensitivity. The leptin regulates appetite and metabolism through hypothalamus. Onset of puberty signaled by the secretion of pulses of gonadotrophin releasing hormone. Prior to puberty, the hormonal feedback, central neurosuppression of GnRH release suppress onset of puberty. The hypothalamo-pituitary gonadal axis starts working in fetus, and after birth, sex hormones and gonadotrophin are found in adult levels. This is the chart you can see. The hypothalamic-pituitary gonadal axis. Your estrogen, progesterone are working. Your LH, FSH are working. There is activation of hypothalamic-pituitary gonadal axis that induces and enhances progressive ovarian and testicular sex hormone secretion, responsible for the profound biological, morphological, and psychological changes that are experienced by the adolescents. Then is a late pubertal period that arises between age of 8 to 11. Adrenal cortex secrete DHEA, DHWAS, and androstenedione. These androgens result in adrenarche or pubarche. Increase in GnRH promote ovarian follicle maturation and sex steroid production, resulting in development of secondary sexual features. Now we'll talk about physical changes. There's reflection progression in changes of the external genitalia and of sexual hair. Secondary sexual characteristics for mean age is 10.5 years in girls and mean age 11.5 is to 12 years in boys. If you talk about puberty in girls, there is thelarche, that is breast bulging, usually is the first sign. Menarche usually 2 to 3 years after development of the breast. Growth spurt peaks before menarche. Pubic and axillary hair growth. The pubertal stages or the tanner are described as P1, P2, P3, P4, and P5. Here you can see the diagram. There is the menarche. During puberty, estradiol levels fluctuate widely. The endometrium is affected by estradiol and undergoes cycles of proliferation and regression until point where withdrawal of estrogen results in the first menstrual bleed. Now we'll talk about ovarian development. The rising levels of plasma gonadotrophins stimulate ovary to produce increasing amounts of estradiol. First ovulation occurs 6 to 9 months after menarche. The plasma progesterone remains at low levels even if secondary sexual characteristics have appeared. Then is the development of uterus. Prepubertal uterus is teardrop shaped. Neck and isthmus account for up to 66% of uterine volume. Following production of estrogens, the uterus becomes pear-shaped. Now, what is abnormal? If there is delayed puberty, that is abnormal. Early or precocious puberty is abnormal, which is common in females. 1 in 10,000 children are affected, and it is uncommon in males. Delayed puberty or hypogonadotrophic. It can be constitutional due to chronic illness, malnutrition, tumors of pituitary or hypothalamus, hypopituitarism. They can be congenital because of Turner or Klinefelter syndrome. It can be acquired because of chemotherapy, testicular torsion, trauma, infection, or autoimmunity. Then is precocious puberty. The onset of secondary sexual characteristics less than 8 years in girls and less than 9 years in boys. It is 5 times more common in girls than premature thelarche or pubarche. Talak is beginning of breast development, and pubark is the first appearance of pubic hair. Investigations are CBC, FSH level, LH level, estrogen, testosterone, prolactin. We can also go for pelvic USS, ultrasonography for ovarian tumors or cysts, testicular sonography, adrenal sonography, brain MRI in all males and patients with neurological signs or symptoms. The management is to treat a systemic disease, psychological support, promote puberty and growth if necessary. For this, we'll give low-dose testosterone and ethinyl estradiol. The issues are behavioral difficulties. We need to give psychological support and go for counseling. So this is all in pubertal changes. I hope you understood this session well. And if you have any doubts, you can post a comment. This session is powered by Digital 2.0 version of Jyoti Vidyapeeth Women University. Thank you.